So today we're going to be demonstrating hip extension muscle testing. So the first thing we're going to have the patient do is to lie down prone on the table. Before we start muscle testing, the therapist is going to take the patient through the range of motion to make sure that they actually have an available full range of motion. Once the patient does have full range of motion, the therapist is going to ask the patient to complete that range of motion independently. Since the patient is able to complete the full range of motion, we know that they're at least a 3. So next, the therapist is going to have the patient complete the range of motion and hold at the top of the range. And then the therapist is going to apply pressure in the downward direction. Since this patient was able to hold against maximal resistance, she's graded as a 5 out of 5. The next muscle grade we're demonstrating is a 3 out of 5. So once again, the therapist is going to ask the patient to complete the whole range, and then she's going to apply pressure. And as soon as the therapist applies pressure, the patient is unable to hold against resistance, which means that she's graded at a 3 out of 5. Lastly, the therapist is going to ask the patient to complete the whole range of motion, and the patient will either be unable to or will not be able to move through the whole range. Since that happens, we're going to put the patient into a gravity-eliminated position, which is side lying. We're now going to have the therapist standing behind the patient. They're going to support the patient's leg and have the patient go through the full range of motion. If the patient is able to complete the full range of motion, they are graded at a 2 out of 5.